can all benefit from the extraordinary potential that the vaccines will provide, because these are the kids that need them the most. So that it shouldn't be just by an accident of fate where you're born as to whether you have access to these vaccines. I had the good fortune over the last 12 months to travel around to participate in launches of the pneumococcal vaccine, and I have to tell you it's an incredibly humbling experience. So, for example, when I was in Nairobi in February this year for a launch, I visited a number of clinics, and I was really pleased to meet the mothers who brought their children into the clinics to get the new vaccines. And many of them wanted the new vaccines because they either had children who died of pneumococcal disease or they had family members who died of it. And they knew that there was a vaccine there, but they hadn't ever been able to access it. And they were flocking in to get their kids vaccinated. Actually, I had a journo last week in London say to me, well, now you have the funds, don't you have a problem persuading parents to have their children vaccinated? And I told him that when he'd seen the mothers flocking into the clinics in Nicaragua, in Kenya, in Yemen, because they'd heard that the vaccines they couldn't afford were available, then he wouldn't be asking that question. Last